Hello, I'm Dr. Lorraine Maita, and I'm here to help you feel good again. I want to help you understand why you may need a menopause specialist to help you. In this day of do it yourself, Dr. Google tells you everything, and so are so many influencers and other people who may or may not be well trained in how to balance hormones and what the implications are. I see everything under the sun, and I've been doing this for many, many years. And right now, I'm here to educate you, not to diagnose or treat. So, always, no matter what I tell you, always check with your doctor. But one of the first and foremost things that I do is to have you try a hormone-friendly diet. Now, sugar and alcohol are going to really flame hot flashes. So that if you have more omega-3 fats, less saturated fats, and more fruits and vegetables, this diet is much more friendly to your hormones and you will feel much better. Cruciferous vegetables like broccoli, cauliflower, kale, radishes, arugula, Brussels sprouts, all of those cruciferous vegetables help your liver break down the hormones in a much more friendly way so that you can dispose of the breakdown products that could be toxic. So, having a hormone, number one, I'm giving you seven. Number one is a hormone friendly diet, less inflammatory foods, less sugar and alcohol. The other is stress. Stress can be distress. So we want to expand the whole definition of stress to include anything physical like pain, heat, cold, hot flashes, night sweats, restless leg syndrome, anything that's physically bothering your body as a distress, anything emotional, worry, anxiety, depression, ruminations, reliving the same situation over and over again is emotional distress, or chemical, which could be the hormone imbalance itself, as well as toxins, inflammation, nutritional excess, nutritional deficiency. So, how do you manage stress? You get to the root cause of fixing anything that may be bothering you, but also to practice techniques that are going to increase the parasympathetic nervous system, the rest, digest, reproduce, rejuvenate, and repair nervous system, and tone down the sympathetic fight or flight nervous system. So most of you probably heard this, reframe the situation. You can't control the stress, but you can control your reaction to it. Deep belly breathing is a go-to because that immediately calms the nervous system down and kicks in the parasympathetic nervous system. There are other things like vagal stimulation, things like humming and singing and yoga, massage can help you. Meditation is great. I love meditation, but not everyone feels comfortable meditating. One of the go-to techniques that I recommend to people is heart math. So that's like deep belly breathing along with feeling gratitude towards something, someone, or some place. That can put you in a parasympathetic relaxation state like that. And you can do it anytime, anywhere, with anyone. And it can change your nervous system in seconds. So, heart math is deep belly breathing, focusing on your heart and focusing on something, somewhere, someplace, or something that you're deeply grateful for and appreciate. That was number two. Number three is monitoring hormone metabolism. Metabolism. This is my pet peeve. I see so many people come to me, they're on hormones, they've never had hormones measured, and no one knows where the hormones are going and what your body is doing with the hormones. So women, even in menopause, make hormones. They make estrone, which is a type of estrogen in their fat and adrenal glands. And women on hormone replacement therapy are given the feel-good hormone estradiol. Estradiol is what keeps you young. It keeps your bones strong, your brains on healthy, and your cardiovascular system healthy. It lowers lipids and it improves the cardiovascular system. So est women are not on hormones can get breast cancer. Women on hormones can get breast cancer, but the risk of breast cancer has been debunked when it comes to hormones. However, regardless of whether you're on hormones or not on hormones, you got to know what your liver's doing with them, right? If your liver is recycling and you've got dirty, stinky garbage that's toxic and damages DNA, and you have a way to make it a safer form that is non-toxic, wouldn't you want to know that? Because it's easy to fix. You can take a supplement and make some dietary changes because what they did studies, women who made 4-hydroxyestrogen either had a risk of breast cancer, a history of breast cancer, or a family history of breast cancer. Women who made 2-hydroxyestrone, they were the ones who never had a history of breast cancer or a family history of breast cancer. It's much more benign, but also your body has to dispose of it. Just like if you put your garbage out on the curb and it's not in a bag or in a bin, the garbage man is not going to pick it up. Now, your body cannot dispose of these metabolites unless they are methylated. And there's a test called the Dutch test, DUTCH, that tells us, are you making a toxic form or not? What forms are you making? And can you dispose of them? So unless you know that, you could be taking hormones and making a toxic form, not disposing of it and reabsorbing. So that's a big pet peeve of mine because if you don't know that and you don't fix that, you may be increasing your risk. And it's not the hormones, it's what is your liver doing with those hormones. And even if you're not on hormones, you need to know this to be safer. Number 4 is addressing toxins. I mean, most of you have heard by now, BPAs and plastics disrupt your hormones. They affect fertility. They act like estrogen and they're considered obesogens, meaning they press the button, they stimulate the estrogen receptor just like it's estrogen, and they make you gain weight and they act like estrogen, but they're not estrogen. And they have some estrogenic effects, but not the good effects. And other things like herbicides, pesticides. So one of the things that I always recommend is do not heat in plastic. And as much as possible, use glass or stainless steel or ceramic, because even when I used to go to Starbucks, I brought my own cup, or I used to use cups when they gave them. So I don't put anything hot in plastic. I never heat in plastic. And as much as possible, I don't buy anything in plastic. And I use, glass or stainless steel. And that's how I store food. And that's how I heat food. And that's how I drink my beverages. Also, eat organic. The Dirty Dozen can be found on ewg.org. They're the fruits and vegetables that have the most pesticides. So if you eat those organic, you're decreasing the toxic load. Those are 2 very simple things that you can do. There's a lot more toxins and a lot of other things, and I cover them in the anti-aging solution and the midlife makeover. So stay tuned because one is live courses coming up. So address the toxins. The other is optimizing sleep. Sleep is when you regenerate and you repair, and absolutely lack of sleep is a distress on your body. And when you have distress, your cortisol rises. It causes a lot of rise in blood sugar, and the blood sugar is not being burned at night. Blood sugar can cause oxidation, and oxidation causes inflammation, and it causes glycation, which causes oxidation and inflammation. So when the blood sugar rises, because cortisol is up, then it raises insulin. You get these hormone seesaws. It wakes people up in the middle of the night because their hormones are out of whack. There's also a circadian rhythm. If you eat late at night, it disrupts your circadian rhythm. If you exercise too late at night, it disrupts your circadian rhythm. And if you get light at night, bright light, especially blue light from your tablets, your screens, your phones, your computer, your TV, all of those things can disrupt your sleep, and that you cannot regenerate or repair or manage your hormones properly if you don't sleep. and you can't lose weight if you don't sleep. And that's a big complaint in perimenopause and menopause. You do everything right and you can't lose weight. Well, sleep is extraordinarily important. And a good menopause specialist can help you sleep with the right combination of estrogen and progesterone. Progesterone is a hormone of peace and calm, and it acts on the GABA receptors that break in your brain. It's a neurotransmitter that calms you down instantly. So my patients absolutely love progesterone because it makes them sleep, it decreases anxiety, it balances the estrogen and helps them keep their weight stable or lose weight. And tailor your exercise regimes. I know my ladies get really upset because no matter what they do, they can't lose weight, at least until they come to me. And they're really exercising much too hard. And that gives a cortisol response. That's actually a stress on your body. So if you're not really refreshed after exercising and you're exercising much too hard and not giving yourself a break and allowing your body to rest and repair, then you are creating inflammation and distress. So too much exercise is no good, just like too little exercise is no good. So having a day of rest between weight, you need strength training because the muscles burn sugar. Sugar is inflammatory. Inflammation disrupts your hormones. So having some weight bearing exercise and working out and with weights, yeah, maybe you have to start low and slow. And if you're going to do weight training, make sure you know how to do it properly. And maybe if you're starting to go up in the weights, get a trainer because otherwise you may hurt yourself. So I would say start doing some, in between weights, do some aerobics and then do some yoga, Pilates, something gentle. You do not want to incite a cortisol response because it's going to have the opposite effect. It's going to break down muscle, break down bone, raise blood pressure, raise blood sugar, destroy your collagen, and your skin will start to sag. And it's going to put fat around your belly. So just the sweet spot of exercising where you feel refreshed, giving yourself some days off to regenerate and repair. And last but not least, monitor your levels. As I said, you just don't know where your hormones are going. You don't know what your body is doing with it. I look at hormones 3D, and the analogy that I use is if I looked at your financial plan to do a good job, I'd have to look at your bank account, your savings, and your income and expenses to do a good job. I have to know what money you have available. Are you saving any and earning interest? And how are you spending it? So when I look at hormones, I look at them, I call it 3D. Blood is like your bank account. It's free to save or spend. It's what's available in your bloodstream to go into the tissues and do its job. So blood measures protein bound to hormones and hormones that are free. So it's only free hormones that get into the cells, but the blood is measuring free hormone and hormone bound to protein that's not free to go into the cells. So that's one set of measurements, and that's the most studied, and I use that the most. Then I'll do saliva, which is looking at free hormone. There's no apples. These are apples to oranges. So some people I say are savers and their blood levels are low and their saliva levels are high, or they're even, or the blood levels are high and the saliva levels are low. It's just a different look. It's, some companies actually tested the amount of hormone in the saliva and did uterine biopsies and matched them up and said that that's what's having the effect in the tissues. So that's the second way I look at it. And the third way is the Dutch test. That's how you're breaking down hormones. At least that's what's coming out in the urine. And that's going to tell me whether you're breaking them down into a toxic form or non-toxic form. So if you're not going to a specialist that's looking at your hormones 3D and helping you manage your lifestyle so your hormones are balanced and that you reduce any kind of risk of weight gain, inflammation, oxidation, glycation, and all the things that age you, your hormones are going to waste. You don't want to waste your time and your money by not having the right balance of all your hormones and the right lifestyle that's going to keep you vibrant for life, right? So download my freebie, the Hormone Harmonized Kickstart, so you can learn more about this. Like or subscribe to the channel. And remember, always check with your doctor. I'm not here to treat or diagnose. I'm here to educate you. This is for educational purposes only. And find somebody who's going to take a thorough look at not just your hormones, but your lifestyle so you can live longer, healthier. Bye for now.